Minister, over the past 3.5 years, your government have been at pains to spin that the health service was being reformed and transformed. The figures produced this week show that nothing could be further from the truth. In fairness to Minister Varadkar, when he was appointed to the job, and since he's been appointed to the job, he has spoken the truth, only to be slapped down by the Taoiseach, who seems ignorant of the truth. The Taoiseach a few months ago told us that Fine Gael had tackled waiting lists, and he told the Fine Gael Ordesh that the problem was resolved, that we were there. However, the actual evidence is very different. The number of patients waiting more than 9 months for inpatient or day case treatment has risen by 1,000% in July. There are now 5,448 people waiting more than 9 months for a day case treatment around this country. There's been a five-fold increase, Minister, in the number of patients waiting more than a year for inpatient and day cases at Beaumont, and there are significant backlogs in the Mater, in Galway, in Cork and in St James's. In 2011, the Taoiseach said that my government are keenly aware of the stress waiting for treatment causes to the citizens of our country. And in response, the Minister for Health has instructed public hospitals to ensure that by the end of 2011, that they have no patients waiting more than 12 months for treatment. Today, Minister, there are 20,928 patients around the country waiting more than 12 months for treatment. Those are the real figures, and they show the extent of your government's misleading of people and inability to manage the difficulties of our health service. You were warned about that, but yet you went with a flawed health budget which took €200 million from hospitals, and that is the cause of these delays. A flawed service plan, Minister.
Please. Thank you.
I know we have the proof. Minister, in light of the evidence, in light of those waiting list figures, do you agree that the health service plan agreed by your government and by Minister Riley was flawed? At the very least, it was unrealistic, that it is not meeting the demands of the people of this country, and how are you going to resolve the issue?
Minister.
Well, thanks very much for the question. First of all, I think it's fair to say that everyone recognises the challenges that exist in our health service. I mean, the truth is that since 2008, the budgets of the Department of Health and the HSE have been cut by €3.8 billion, and there has been a very significant reduction in staffing levels. But despite that, the Department of Health and the health services are actually increasing their treatment of patients, and I think that is the backdrop here. There's 115,000 more patients being treated in our hospitals today than there were 4 years ago. So there is a lot more work being done. The other aspect which are clear in today's figures is that the emergency department workload has significantly increased, and that is putting pressure on elective surgery, as it always has done in the past. So there's no doubt that there are challenges here, but the truth is that reform in the delivery of the health service remains the only route to resolve these issues. We have to move to systems that can better manage the flow. We have still problems in that. We have too many people turning up in the emergency department that could be treated in primary care, and the strategy is to roll out primary care. We still have problems with discharges from our hospitals, and there's a strategy to address that. So I think the reform plan is clearly on the right tracks, but there are difficulties, as everyone acknowledges. And I think these figures show some areas of significant improvement. As you can see, the waiting lists for outpatients are much improved. The waiting lists in emergency departments are much improved, but there are other areas where there's continuing challenges.
Deputy Calleary.
20,928 people particularly appreciate the challenges. Your own local hospital, Beaumont, the clinical director described some of the facilities there as unsafe. And you speak about the difficulties about getting people out of hospital beds. The situation in Beaumont is being worsened by an increasing number of patients in acute beds fit for discharge on a waiting list for nursing home beds because you can't manage the fair deal scheme. You speak of primary care. What are you going to say to the 350 GPs who, for the first time ever, GPs have to take to the street today to wake up your government to the reality of the crisis in primary care. So primary care, hospitals, nursing homes, your government, your current colleague, the Minister for Children, is responsible for all of it. A flawed service plan. You took €200 million out of the hospital budget, and that is a direct consequence. So wake up, Minister. Wake up. You're not transforming the health service. People are on waiting lists, 1,000 increase in waiting lists, and you are ignorant of the problem. I really cannot understand why the Minister for Health, who has the courage to actually tell it as it is, gets slapped down, and those who cheerlead this disaster, who cheerlead this crime against the citizens of this country, are promoted within this government.
I must say, I'll take no lectures from Fianna Fáil on the issue of health reform. Your former leader committed that in 2004 he would eliminate health waiting lists. He presided over a Department of Health that increased its budget by 50%, that added 30,000 people to the health service, but he still didn't resolve any of those issues. And if you go back over the years, and I well remember, you had 25,000 people waiting over 6 months to have treatment. So the problems were there in your time. You threw money at it and didn't deliver. We are having to resolve the health challenges in a very difficult environment where budgets are falling, where staff numbers are falling, and despite that we see more patients treated, fewer waiting for outpatient, less people on trolleys. So there is progress being made, but I'm first to acknowledge that this is a challenging area of reform. We have a new minister, he's setting out his priorities, and he will get the results in this area.
Thank you.